Okay, yeah. Hello, my name is ORITSEWEYIMI Ajogri. I'm going to be doing a video presentation on deliverable 7. Okay, right here, I'm going to explain my first slide to you. On my first slide, what I did is I wrote a letter to accompany the intake packet. So that's the first question. So on my letter right here, what I included in the intake information sheet is the date, name, date of birth, gender, maternity status, address, contact information, and email. So what I did on the next step is I explain an explanation of the importance of LTIC. So hospitals are very much concerned for the health of the patient. This is a small hospital, but having all the medical and surgical facility built. So what I include is just what you can, as a patient, what you can benefit from the hospital. So on the other side of the first slide, I wrote why each part of the packet is included. Intake packet in the hospital helps to gather information in details about the patient's health and the patient's well-being. So I'm going to go ahead and explain my third slide of section 1. So on my third slide of section 1, I explain how the packet is being used. Intake packet is used to obtain information. So the Tristar Hospital used the intake packet to obtain information, to gather information from the clients on their first day of visit, information regarding their well-being and their health. So, and I included EPO confidentiality. So this means how the patient's information will be kept confidential from others. So I'm going to go ahead and explain my fourth slide of section 1. What I did is the privacy pledge. So right here I explained that the hospital must keep the patient's information private from cyber thefts from every other person, except the patients give the privilege for the hospital to give out to the information to a certain person. So on my fifth slide, I explain the sample of living will. So I explain how a living will is meant to be. So a living will must be prepared that include the entire clause related to requirements and willingness of patients. Patients mentions all its will if he has to bear some serious disease. So I think if that is what I included on the fifth slide. So I'm going to go ahead and explain. Here is my second section of my paper, which is the ethical value, ethic and value of organization. So what I wrote here is hospitals are very much concerned for the health of patients. This is a small hospital, but have all the medical and surgical facility built also available to all patients, to all their patients. So what I wrote here is I wrote a brief explanation of what the patients can benefit from the hospital on my second section. So the first slide of my second section is the code of ethic. So the code of ethic include uphold the policy of the hospital, protect this code of ethic protect the hospital, the physician, and the patients too. So altogether, the code of ethic is meant to use to protect the patients and the clients and the doctor's information. So I'm going to go ahead and explain my 8th slide to you is purpose of intake packets. So intake packets in the hospital help to gather information in details about patients. So I think I said this before. So intake packets is used to gather information, as you can see on my slide. So when the patient's first visit to the hospital, an intake packet is used to gather information regarding the patient. So I'm going to go ahead and explain my other slide, which is the explanation of privacy. So this means that the patient's information is meant to be kept private from others. So I'm going to go ahead and explain the other slide, which is descriptions and encouragement to sign the form of acknowledgement receipt. So after explaining, giving the patient's idea of what was expelled from the hospital, so you have to make the patient sign an acknowledgement, which means the patient understand all your information. So, and it means like the patients understand the environment he or she is getting into. Basically, that's what acknowledgement form means, like signing an acknowledgement form. On my other slide is the reference page, and then the last slide is going to be the link to the link to my presentation. And thank you for listening, and I hope you understand my accent. Thanks and bye.